Yeah,
Hey, Anissa, how you doing?
I'm good. How are you?
Good, thanks.
Welcome, Lieutenant Hayes. How are you?
I'm well, thank you, Counselor. How are you?
Thanks for being here with us today.
Oh, it's my pleasure. Am I looking at the wrong camera again? Oh, this way?
Yeah.
Is this on? Oh, they
Yes.
heard me.
I see you.
Okay.
Thank you for being here.
Yep, no problem.
Good morning, Pat. It's Ed Flynn.
Good morning, Counselor. How are you?
I'm fine. How are you doing?
I'm well, thank you.
Good.
Morning, Ed. How are you?
Hey, Michael, how you doing?
Good. If Kerry's on, can you just let Kerry know I'm trying to get on from my home computer, but it's not letting me go on.
Yeah.
Nice. Hold on one second.
Hey, Michael, I just sent you a text, right?
Good morning, counselors.
Good morning, Commissioner. How are you?
I'm good. How's everybody? All right?
Good. It's good to see you, Commissioner.
Likewise.
How are you, Commissioner? Nice to have you.
Good, thanks. And I got my expert on the case right here, Pat Hayes. So you're in good hands.
I know we are.
Okay.
Pat's a
Pat.
good man.
Pat Coulter and Joe King, thank you for being here as well.
Thank you for having me. Let's try to get my video going. Sorry.
That's fine. You're fine. We got a few more minutes. Hello, Dr. Hamrock. Thank you for being here.
Mhm.
Pat, is Felicia with you?
I would have to unmute to answer that, but I believe she's doing a program at 10 o'clock at Rivers.
Okay, all right.
There we go.
We're waiting for the vice chair to join us to start today's hearing, so it'll be a few more minutes. Morning, Kenzie.
Morning, Madam Chair.
Oh, no,
No, not Chair, sorry.
nope.
Just hi, Anissa.
Hi, there we go.
Hi, Commissioner, nice to see you.
Hi, Counselor. Good to see you again. Everything good?
Yeah,
All right. Sounds good.
all good. It's been a while.
Anissa,
Yeah.
Yeah.
That's good.
Good morning, everybody. Good morning, everyone. We're
Oh,
gonna-
morning, Michael.
Can everyone hear me clearly? Because I'm gonna have to join. I'm having
Yep.
computer problems, but I'm on the phone, so I can deal with it on the phone. So if everyone can hear me clearly, we can get started.
You're very clear.
Figure we have everyone with us. Let me look down the list. Very good. Okay. Kerry, you ready to roll?
Ready when you are, sir.
Very good. So we're gonna bang in the meeting. Today, we're having an order for a hearing on docket 0503. Today is Friday, December 11th, 2020. And my name is City Councilor at Large Michael Flaherty. I'm the Vice Chair of the Boston City Council Committee on Public Safety and Criminal Justice, and standing in on behalf of our colleague, City Councilor Andrea Campbell, who is the Chair. And we are here today to discuss docket 0503, order for hearing regarding access to wellness programs for first responders. This matter was sponsored by our colleague, City Councilor at Large, Anissa Asabi George, was referred to the committee on March the 6th, 2020. Today's virtual hearing is being held in accordance with Governor Baker's March 12th, 2020 executive order, modifying certain requirements of the open meeting law and relieving public bodies of certain requirements, including the requirement that public bodies conduct its meetings in a public place that is open and physically accessible to the public. The City Council will be conducting this hearing virtually via Zoom. This enables the City Council to carry out its responsibilities while adhering to public health accommodations and ensuring public access to its deliberations through adequate alternative means. The public may watch this meeting live stream at www.boston.gov/city-council-TV. It will also be rebroadcast at a later date on Comcast 8, RCN 82, Verizon 964. It is also currently being streamed at boston.gov/city-council-TV. We will take public testimony at the end of the hearing. So if you are interested in testifying, please email ron.cobb, that's COBB, at boston.gov for the Zoom link. You should also follow along on live stream, and we will announce when it's your turn to testify and then admit you from the waiting room. Please ensure your name on the Zoom reflects the name that you have signed up to testify under. With that said, today we are joined today by Lieutenant Patrick Calter, Emergency Medical Services, Lieutenant Patrick Hayes, Boston Fire Department, Sergeant Joseph King of the Boston Police Department, Dr. Michael Hamrock, a former firefighter and department physician for the Boston Fire Department, who now provides primary care to Massachusetts firefighters at Stewart St. Elizabeth Hospital. And I also see that we have the great fortune to have our fire commissioner on, Jack Dempsey. So it's great to see Jack. And I'll obviously, as courtesy as the commission, I'll allow our commissioner to begin the presentation from the panel. But before I do that, I want to turn it over to the lead sponsor, my colleague, City Councilor Anissa Sabi George, and then we'll take folks in order of their arrival. Thank you. The chair recognizes Councilor Sabi George.
Thank you very much, Mr. Vice Chair. I filed this hearing order back in March of this year to tackle a problem that is of a particular interest to me. First responders, our police, fire, and EMS are here to provide aid to those who have suffered traumatic events, and as a result are also the first to witness these horrible events. For many psychological and physiological reasons, continuously witnessing these events creates a particular kind of stress on the body that has led to higher rates of depression, PTSD and PTSI, and suicide for our first responders. Everyone deserves access to mental health care and wellness programs. Some improvements were made after the Boston Marathon, but there are still many more that we could do. We don't want first responders to be debilitated or triggered while on the job, and we don't want their families to bear the brunt of that trauma. It will be better for everyone if our first responders are getting the care and have access to the care they need so that they can give us as a city all that we need. I look forward to today's conversation and hearing how we can improve both mental and physical health support for our first responders. And I'm grateful for everyone who's joined us today for this panel, for this discussion, for this conversation. Especially pleased to see Commissioner Dempsey with us, and a special thank you to Dr. Hamrock, who's joined us to also talk about his work and his experiences. Thank you, everybody. Thank you, Mr. Vice Chair.
Thank you, Councilor Sabi George, and we've been joined by our colleagues, City Councilor Ed Flynn and Councilor Kenzie Bark at this point. And for brief opening comments in order of arrival, Councilor Flynn, do you have any opening comments?
Thank you, Councilor Flaherty. Thank you to Councilor Sabi George for filing this order, this important hearing order, and to you, Councilor Flaherty, for chairing it. With this pandemic still raging on, it's important that we ensure that our first responders are healthy, both physically and mentally. So I'm glad that we're having this conversation. Even before COVID-19, our first responders are constantly performing under stressful situations. And just as a reference, I filed a similar hearing order about creating a health registry for our first responders so that we can keep track of the impact of COVID-19 on those who are closest to it, so that we can better provide the services needed for those who may still need such programs, medical, mental health counseling as well. Just as a quick example, the stress that our first responders are going through now is almost like a deployment in the military. I served on 2 deployments, and let me tell you, after coming home, your life and your body is not the same. So we're going to have to recognize that the police, the fire, and the EMS have done an exceptional job over the last year, are going to need the needed care, and for their families as well. So I hope we can also have a conversation later on about a health registry. But in the meantime, thank you, Councilor Sabi George. I think this is one of the most important hearing orders I heard that we filed all year. And it's important that we make sure that our city workers that are there for us all the time, that we're there for them, because I don't think at times society has been there for our city workers, especially during this difficult period in our city and country. Thank you, Councilor Sabi George. Thank you, Councilor Flaherty, and to the first responders that are with us today.
Thank you, Councilor Flynn. We've also been joined by our colleague, City Councilor Matt O'Malley. Chair will recognize Councilor Kenzie Bark at this time for an opening comment.
Thank you, Mr. Chair. I also want to thank Councilor Sabi George for calling for this hearing today. I think that we in so many ways ask our frontline workers, and especially our first responders, to really confront all of the hardest moments and places in our society. And I don't think we have a history of giving enough support, especially on this mental health side. And it feels to me as though we've progressed in terms of talking about the mental health and PTSD implications of all of this. And I think we've made some good moves in terms of putting some programs in place in the city, but we're still in that phase of how do we get people to take advantage of those programs, and how do we really scale it up? Because I still think that we struggle with a real social stigma in which trauma is invisible and so not real for people. So really looking forward to the conversation today and learning more about what we're doing and how we can do more on this front. So thank you, Mr. Chairman.
Thank you, Councilor Bach. Chair recognizes Councilor Matt O'Malley for a brief opening comment.
Thank you very much, Mr. Chairman. Of course, I too would like to add my voice to the chorus, thanking Maker Councilor Sabi George for her leadership in this space. Proud to support it, and obviously underscore the points that have been made by so many colleagues. And that's, we know, or we don't know directly, but we can certainly understand the enormous stress, the physical, emotional, mental stress that our police officers, our firefighters, our EMTs, our paramedics always have to endure, but particularly during pandemic. You know, our public safety forward-facing personnel can't work remotely during this time, and they have done an exceptional job. So we want to make sure that the support is there and that the opportunities are there. And the purpose of hearings like this is just to check in, convene all the relevant stakeholders to make sure that we're not missing anything, and from our point of view, to make sure that the funding will be available as we proceed through the next year particularly. But really just wanted to add my voice in support. Thank you, Councilor Sabi George, for highlighting this vitally important issue, and great to see my colleagues in government and thank you all for your great work. Thanks.
Thank you, Councilor O'Malley. And as councilors join, I'll make sure that they get recognized in order. So with that, and obviously through the lead sponsor, I guess I'm going to turn it right over to our invited guest. And I'll start with our esteemed Fire Commissioner, Jack Dempsey. So Jack, if you could take the floor. And I also see a dear friend and a old classmate of mine, Joe King, here as well. So make sure we get Joe on quickly as well. So with that, Commissioner Dempsey, you have the floor.
Thank you, Chairman. Thank you all as city councilors for giving us the support in this very important part of our job. Between Boston Fire, Boston Police, and EMS, we have a great team that works together on this. It's a silent illness that I guess we could put it that way. That the first responders we're used to being the rescuers, and so this is a very difficult thing to deal with from our angle, because we're used to rescuing people, and to be the victim is hard for guys to speak up and look for help on this. So this is critical that we have the support from you, and that we're able to continue with this program for all our people. Thank you again, and I'll turn it over back to the chair. Thank you.
Thank you. And if with your permission, of course, we'd like to maybe go now to Lieutenant Patrick Hayes for the Fire Department. Commissioner, is that okay?
That's great. Yep, Pat, take it away.
Pat, you have the floor.
Good morning, councilors.
Good morning.
Do you have a question for me, or you want me to just describe?
Well, just I didn't know if you had an opening statement, or if you anything from your perspective. Obviously, you're in your position as lieutenant in the fire department, and some of the things that you see on a regular basis, I think would be helpful for us as a council. I mean, the fire department, the police department, and EMS, our first responders have always enjoyed a great relationship with the Boston City Council. You're out there on a day-to-day basis. We see you out there. You're our neighbors. You're our coaches. You're at the local charity events and volunteering, and so it's like a big family relationship here. So we appreciate and respect the work that you do. But in your, I guess, in your formal position at the fire department, you see things that I think we need to know and learn about, and find ways to better service you as your councilors.
Well, fortunately, we have a great commissioner, a great command staff, and a great local 718. And they've always been pursuing and advocating for mental health and substance abuse treatment and physical fitness in the firehouses. So in the past year, we've trained another 50 members in a peer support program, and I believe the number is up to about 74 CISM peer support trainees. So it's about 2 per firehouse. Also, in the past year and a half, we've trained over 40 firefighters as recovery coach. They took a 5-day substance abuse class, and actually a couple of the Boston police and maybe a couple of EMS and city workers took the class with us at our office at Dry Dock Ave. So we've always been kind of on the forefront of trying to get people comfortable to talk to people about things. We also have a couple of members on the department that are great resources for us. We have one member that was actually, he's a clinical social worker that was part of the BEST team out of Mass General Hospital. And we also have another member that is an outreach coordinator for home base for veterans. And I've called them for assistance on a few things. We also have teamed up with McLean's, and I have to give credit to the Boston Police Peer Support for initiating that. They took that after the Marathon bombing and really were on the front line getting mental health and substance abuse treatment for our members. So the Boston Peer Support Unit really did a great job with that. And we work with them a lot. At admissions, they have the program, the LEADER program. It's LEADR, law enforcement, active duty, and emergency responders. They could do a 2-week inpatient program there, or they can do an IOP, an intensive outpatient. So we have a lot of resources that are available, and our members are pretty open to it because a lot of them are veterans, like Councilor Flynn was saying, and talking about stress is becoming more of a workplace normal. It used to be that you didn't talk about that stuff, but now members are discussing a little more, and it's a good thing. It's an open conversation. Also, we've had to stop the live EMS training that we've been doing because of the COVID restrictions. But during that training, it's a 6 to 8 week training where they bring all the companies into the city for a training block. And usually once a year, they'll have me and a couple of people from the peer support and the CISM team talk to the members for 15 to 20 minutes before the class to give contact information on who to reach out to, who in their district, who in their firehouses. If they're uncomfortable coming to the EAP, they can talk to another member at the firehouse. And we can make an accommodation for people that way also. So we've always been pretty good with it so far. And I think we just got to stay on track with it and stay on top of it.
Good. Thank you, Lieutenant. Then we're going to stay with the fire and go to Dr. Michael Hamrock, and I think who's beloved among the members and their families, largely driven by a lot of the early detection work that he's done as a physician. And also, I think some of the changes around the health and well-being have been a direct result of what he was saying as the physician in not just for the Boston Fire Department, but for firefighters across the Commonwealth. So without further ado, I just want to welcome Dr. Michael Hamrock to the panel to offer any comments that he may have at this time.
Mr. Chair, I'm not sure if Dr. Hamrock is with us yet. I see him on the screen, but not unmuting. Perhaps we could go through police and then EMS and then back to Dr. Hamrock.
Very good. So with that, I see Joseph King, Sergeant Joseph King from the Boston Police Department, who's done great work in this space around health and wellness of our police department. So Joe, you have the floor. Good to see you, and let's hear your thoughts.
Thank you much, councilors, and thank you everyone who's spoken already. Actually, was some of the points were all made to start. I guess just a little something. So since we're on the record here, just the Boston Police Support Unit was created in 1974. It was called a stress program, and under Police Special Order 7485. It was since 74. It's evolved in a ton of different levels. It ended up becoming called the Boston Police Stress Unit, and then eventually we became the Boston Police Peer Support Unit. And a lot of that evolution came from a ton of assistance we had from Dr. Hayden Duggan and his crew out there at the Gardner Group that the police department has a contract with, which they provide a ton of assistance and services and counseling and therapy for our officers. We primarily got a lot of the stuff we were doing revolved around what would be called known as critical incident stress management. And for us, it would be the typical stuff that the public thinks of, police shootings, death of a partner, mass casualty incidences, i.e. the Marathon bombing, and then the usual calls that, police, fire, and EMS are dealing with all the time, which involve children and families and a lot of intense scenes that I don't need to go into detail in this meeting about. So what we now have is the peer support unit here of the police. I myself is in charge of the unit as the director. We have full-time police officers and detective staff here at the unit. Also under the umbrella of my peer support unit is the family assistance unit, which is another name would be the hospital liaison unit. And that's staffed by full-time police officers, detectives also. And what they're doing is assisting. We have a regular, I'd say a couple times a day, it seems like, at least, depending on the week, injured officers on a regular basis, mostly minor stuff, trip and falls, injuries occurring during arrest, motor vehicle accidents, things of that nature that are common stuff that happen on a regular basis. And then obviously up to the more intense, high profile stuff that people unfortunately hear about. So the family assistance officers are important in assisting the officers getting through the hospital system, assisting their families, getting through the hospital system. They also assist officers with retirement issues and also funeral arrangements for fallen officers or officers that have retired in the past, or active duty officers who have retired. We also have what's a volunteer team, which is widespread throughout the city, called the Critical Incident Stress Team. And that team is made up of volunteer officers that are in all the districts, specialized units and such. And they're out there kind of being the eyes and ears for us of the peer support unit. We have monthly meetings with this team. We have training with this team. The team is a certified member of the International Critical Incident Stress Foundation, as well as a member of the Massachusetts State Peer Support Network. All the officers are trained in basic critical incident stress management, usually based on the Mitchell model by Dr. Mitchell. And we're supervised, the training and the certification is also supervised by Dr. Duggan to make sure we're in compliance and up to date and all the latest techniques. The officers assigned to the peer support unit here with me I have the basic and the advanced training, as well as I have 2 officers that are licensed alcohol drug counselors, which is a huge benefit, that are working here full time. So, and those are our full-time officers. Just to be clear, the unit is a highly confidential unit. We don't keep records. We're not fit for duty. We're not doing evaluations to determine if somebody should be at work, not at work. The department has other resources that dictate that. And we're not connected to the drug testing or internal affairs or disciplinary issues or anything of that nature. We're here basically to support exactly what the name says, be a peer support unit and support our officers. Couple of just things when I was briefing yesterday, and then the bullet notes I had sent out prior to the meeting. Most people know, especially the people I think here on this panel, obviously understand what's going on in the daily life and of the police officers. When I say officers, a lot of these things are going to also cross over in about 100 different levels to fire and EMS, but I can only speak to my portion of this. Right now, I think there was a great point that was brought up earlier, that we are members of the community. We have been members of the community, most of us lifelong members of the community. We come from the community, we still live in it. Most of us spend more time out in the community than we actually do in our own homes. It's been the breakdown of it when I look back. And just like anyone else in the community, we have families. I think people forget we have spouses, maybe elderly parents, children, all with different various issues that everyone else is going through, whether it be bills, school choices, illnesses, all that, marital issues, all that stuff. And I say that because I think lots of times what happens and what I see happening, especially with police, is people see an outside, they see a blue uniform, they see the police, and they forget that, these are people that actually are going home, paying taxes, paying bills, having spouses, having issues, everything that goes on with everybody else in society. Everybody knows the job. They're familiar with it here. We see what we're doing out here all the time. It's, the usual stuff, domestic violence, motor vehicle stops, lost kids, landlord-tenant disputes, all the normal. And those calls come in by the hundreds, thousands throughout the year. And then you have the stuff we have, the usual high profile stuff that everyone likes to talk about, the shootings, the firearms, the homicide rate, which is, it's gone through the roof. And officers actually, most importantly, I think, in which we've learned in peer support is what officers will always talk about the last is themselves. they'll be the last ones to tell you about them being assaulted, them being hurt, them being the victim of a crime. They won't bring that up. They won't talk about it. But, you know, prepping for this meeting, I took a look and I realized that since 2013, we've had 8 Boston police officers shot in the line of duty. Since that's 1 per year, if you count 2013 and include 2020, shot, not shot at, but shot, hurt, and, you know, probably retiring because of their wounds. That doesn't count the amount of times officers have been shot at, threatened with firearms, or, you know, and it also doesn't count the marathon bombing and the officers that took shrapnel with that. I bring that up not to be dramatic, I just bring it up because it's a backdrop and an ever-present reality of a police officer and their state of mind. Since we're talking about officer wellness, I think the biggest thing with officer wellness, and the doctor will be able to get into a lot of it too, you know, with issues of adrenal fatigue and things of that nature, and the stress response that's, you know, a major part of the physiology of any human being is so hyper exasperated in the life of first responders. And like I said, and obviously, but the thing with police officers is the issue of is, you know, we just respond to calls. We're expected to be proactive. We're out there initiating a lot of our work, which is part of you know, community policing. We're not there to respond. We're there to be out and be proactive, be in the community, and with that brings a lot of I guess a heightened state of awareness, because we're talking about officer wellness here, and the physiological effects that come along with that. And I think I don't, and I'm going to leave that a lot of that to the doctor about the, you know, the overloads of adrenaline, cortisol, you know, fatty acids being dumped into the body, all that stuff. It's a kind of above my pay grade and expertise, but it is something we're very well versed with here at the unit, which leads to a lot of obvious cardio issues with officers, and then also the chronic exposure to the stress and the physiological and mental exposure to constant stress is, you know, I don't want to say obvious, but I think when you do it, it becomes our heightened suicide rate that comes with the job. And, you know, the primary mission of the peer support unit is suicide prevention for our officers. You know, I kind of listen right now as the director of suicide prevention, job retention, and family success. Because if you don't have the first two, you're not going to get the third. And if I can keep the third, maybe I can get the first two. It's those three, and in that type of order. I can say since March, since COVID has started, all the stuff I've talked about, it's just been like throwing fuel onto a fire. We're all dealing with the same thing. Spouses, you know, we don't work. We're not allowed to work remotely. We don't work remotely. We show up every day, and on top of not working remotely, we're actually getting ordered to work at a level they haven't been working at. More officers talking to me that, you know, I thought I was going home. I told my wife I was going home, and guess what? You're ordered. You're not going home, or you're going home but come back in 6 hours to go to work, whether you want to or not. And then they get portrayed as being greedy for the money, and it's like half of them are like, I don't even want to work the shift. It's just been this, and these are all things that are chronic stressors in the officer. I call it, I like to call what happens with police work emotional erosion. It's not hitting you all at once. It's just all these, like, you know, death of 1,000 cuts, you know, calls, what you're going to get. If you're in a busy district, you're going to get a bunch of routine calls, and then you're going to get spikes of very high intensity calls. And that's within one shift. And then now you have to deal with, my kids are learning remotely. You know, my spouse can't be home tonight. We have to, I just got ordered. I'm going to have to call my parents. Hopefully they can make it. If they don't, you know, these are all the cumulative effects of that come with this job. And like I said, most officers, they're not complaining about it. You know, the only thing they do anything, it's just mostly being their time off being taken away from them when they do have it. That seems to be the biggest thing. Also, since March, you know, I mean, the obvious thing has been the and it kind of, Councilor Flynn touched on it. And I'm an Army veteran from the first Gulf War, and I've been in multiple critical incidents on this job. But what's happened as of late is, especially in the internet, and is our officers and their families are getting now threatened and attacked remotely. It's not just aimed at the officers. We're having a bunch of reports of their parents being verbally threatened, their children being cyberbullied constantly, or bullied or threatened in real life, or they walk out of the house and neighbors screaming at them, calling them all sorts of vile names and saying that their parents are evil. It's been a whole new level. We have documented incidents of vandalism, officers' addresses being displayed on the internet. There are identity issues. We're having a lot of problems now. I'm hearing about identity theft with officers because of certain websites putting out officers all their personal information, and people are taking and running with that. And now we're getting a lot of issues with identity fraud with the officers. And I bring up the issue of being deployed. It's that I remember from being deployed, and the difference from being employed and being a police officer was when I was deployed, they had to be at work 24/7. There was no safe spot. I couldn't go home. If I was in at night, we'd be dug in, you'd be in your hole, you had 360, you had fire watch, you had this exact, and then during the day you did your mission. Or maybe at night you did your mission and during the day you slept, but you still kept the perimeter security. Being a police officer, the idea is you go do your job and you come home and you have some respite. And now what's happened with this whole new thing is there is no respite because the officers are being portrayed a lot in the media as the ultimate evil empire, for the lack of a better term. And now what's happening is their families are under threat, literally. Their private homes are under threat, literally. And they're not even able to get down to drop that heightened level of awareness, and hypervigilance never leaves. They're constantly at this alert state that's up here, and they constantly have their head on the swivel, and the burnout is evident in it. And I think also too, it's a game changer, because once you start involving people's personal life and their family, police officers accept and understand the fact that not everyone's going to like them, and that's part of the job. You're basically here to tell grown people no. You can't do this. You shouldn't do this. We're going to have to stop you from doing this. And the society we live in, it's a hard thing to deal with, which we understand. And we handle it professionally. We've been called names. We've had racial epithets thrown at us. We've had all sorts of things done. But what's happened now is it's gone to a level where our families are being assaulted and threatened. And that's, for a lot of these officers, that's where the line's getting across, and that's where they're having a lot of issues, even questioning whether they should even be doing this job, to be quite frank. Because there's that line. That's the line that did it for a lot of them. And like I said, the physiological effects, and which we've known about in the peer support unit, thanks to Dr. Hayden, and Dr. Hayden's been singing the praises of Dr. Hammerrock's work. It just seems to dovetail so much together, all the stuff we've been dealing with that I know in my experience in peer support for 20 years. Just the overload, the constant stress response, the constant alertness. The burnout rate is severe. So, not to paint a grim picture, I'm not trying to. I'm just basically saying what's going on right now. The officers get on this job. They want to be police officers. They go through 6 months of the academy of intense training, and they stick around because they want to do it. I counsel a ton of young officers. I call them the prime ones, the ones you want to get there, between 25, 35 years old. They get 7 to, a couple of years to 10 years of experience on. They're very proactive. They're very intelligent. A lot of our officers are, thanks to Quinville, are highly educated, and they're insightful, and they're motivated, and they're proactive, and they're in the old term way. I look at it as an old guy. I'm the old guy now with them. I'm like, they're good cops. They're real good cops. Yeah, but they're also at the point like they're half the time they're sitting there talking to me, going, "Why am I even doing this anymore?" And it's just due to more than anything, the feeling of no support. And I'm not saying that as an accusation. I'm just saying that this is where it is, because with the department, I believe, and especially with the commission we have now, and the past couple of commissioners, we've been ahead of the curve. And I'm not saying to blow our own horn on peer support for years. The doctor we have has been ahead of it. He's debriefed people. Hayden's done people from both World Trades to Ruby Ridge to Waco to Oklahoma City. It's just a wealth of experience we have. The past directors we have here have been phenomenal. I have big shoes to fill. It's really how I feel. And it's just a different time right now. The officers are feeling it. But we do have, just so we know, I guess the up end, we do have the unit. We're still doing a ton of confidential. We're still doing a ton of one-on-ones. The grant that we got, that the city council approved for us earlier this year that I testified at, it's already paying dividends. We were able to, like the fire, we trained 50 guys and women in basics, critical incident stress management. We've increased our hours for the counselors to be able to come in and have one-on-ones and do wellness checks with the officers, and increased our residential hours that we get up at the on-site academy. We have later. I've been able to establish a really good rapport with the vet center and have a good contact with them down in Black Falcon, which I believe is probably one of the best programs there are for veterans. But the thing is, like I say, I think the whole concept is to dovetail all these services together as much as possible, have them working hand in hand with each other, because there's so many things that go together. So thank you. I have a bunch more, but I'm going to reserve, just give up the time at this point. I appreciate your patience and listening.
No, I appreciate the heartfelt response, Joe. Obviously, we've known each other over 35 years, so you have firsthand lived experience serving our country and serving our city, and your commitment. First of all, your proof that the wellness program works, but also your commitment on part of the peer support, as well as the critical stress management on behalf of the men and women of your department and as other departments. I'm very proud of you, Joe. Really, really am, and I wish you continued success in this program. This is a great role for you, and you're doing great work on behalf of the department in our city. So with that, I'm going to turn it over to EMS briefly. I know that Dr. Himmick has also joined us as well. We're going to go to him last on the panel, but if Patrick Halter could just introduce yourself, and you have the floor.
Councilors, thank you for having us. It's almost hard to believe it or not, that we're here talking about this topic, and it's a testament to your commitment to supporting those of us, and including yourselves, who serve this city, residents and visitors. And Massachusetts, historically, is the home of peer support, and Boston has often been the units that are pushing the envelope. Not to toot our own horns, but most of our programs have been around since the 70s and 80s. Back when, even still today, it's still stigmatized, but we're getting better. And part of why we're getting better is culturally the generational differences that are coming in the doors that we're committed to hiring. And they're not as apprehensive to talk about things that generationally you may not be comfortable doing. So having a program in place that serves all of the backgrounds of an agency is important, but also a commitment to saying, and I challenge every recruit in the first week of the academy when we see them, if you treat trauma, mental health, and the things that you're going to see like you would a physical injury that you can visibly see, if you commit to doing that, you can walk out the door in 32 years of a healthy career the same way or better than you walked in. Now, that's a lofty goal. It is a very, very lofty goal. And it's something, and it's the benchmark that I strive for. And if you're busy putting out the shed fire and you don't realize the house is smoldering, it's very easy to lose track of what you're trying to do, which is not only prevention, but resilience. And to commit to that upfront through initiatives like health and wellness are part of the way of getting there. It's not the full way, but it is certainly a very good way of starting. Just 9 months ago, and we have a presentation, I'm not sure, Chair or Councilor Sabi George, if this was where I would put that up or where Fernando would put it up, but it's a very brief. I look forward to showing you it's a quick 10 minutes on just looking specifically at health and wellness and keeping in mind that we're currently in a pandemic. There's not a person in this not room, but virtual room that is not aware of that. But we had to double down efforts. We had to change essentially everything we know about delivering services to the members that we serve. And that was kind of calling an audible. We had to quickly shift and pivot towards delivering service virtually to an extent. So it's a testament to you folks that we're here talking about this important topic. It's also amazing we were able to get all of us in the same room at the same time. And I look forward to showing you the steps we've taken to not only help get our members through this incident currently, it's unusual stress that we're under, but also where we're pushing the envelope to where we intend to bring them in the coming days, weeks, months, and years.
Good. Thank you very much. And we're also joined by Dr. Michael Hamrock, and I had introduced him earlier as someone that the fire department, particularly our Boston Fire Department and their families, really have a great deal of respect and indebted to, and his efforts, particularly with early detection around heart and lung and cancer issues that arguably has probably led to sort of a recommitting ourselves and a refocus on wellness for the fire department. So without further ado, just want to introduce Dr. Michael Hamrock, if he could give opening comments.
Thank you, Councilor Flaherty, for the nice invitation, and also Councilor Sabi George for inviting me here today to present. It's a real honor for me to take care of first responders in the city of Boston, and as a long-term city of Boston resident, I think we're blessed to have such a dedicated force of first responders. So with that, I'd like to start, and also like to give a shout out to Commissioner Dempsey and Pat Hayes from the Boston Fire Department, who really did help develop a model program on first responder health and wellness. So I'm going to do a slide presentation. It's about 20 slides. We'll go through kind of explaining what the work we've done with the Boston Police Department. And you know, we're going to talk about medical screens, but as you will see, most of these medical conditions have an underlying mental health component to it that I believe is causing, you know, heart disease, cancer, and stress in first responders. So I do hope you can pick that up. Everyone can see that okay?
Yes.
Okay,
That's everything, Doctor.
So I'm going to talk about promoting culture, health, and safety and fitness for Boston Police EMS. As I said before, the fire departments are 5 years ahead of us in this matter. We screened 402 Boston police officers, EMS members for occupation-related heart disease and cancer, and found a lot of significant diseases. I'm glad we get these screenings done, but my ultimate goal is to actually prevent these illnesses from happening in the first place. And that's where we really need to focus on health and wellness of all first responders. Really thinking about them as tactical athletes to eat, train, and sleep like an athlete. Most athletes retire in their 30s. First responders have to stick around until their 60s, still doing the same job that's beating them up tremendously. It's going to focus on mental health and physical wellness, peak performance, longevity after retire. I know there's about 80 Boston police officers retiring this month. And unfortunately, statistics do show that 50% of them will not be alive in 5 years because of the stress of the job over the years. So we really got to prevent that from happening. Cost savings to the taxpayers. You know, I'd rather spend my tax money in Boston on health and wellness programs for prevention purposes than what we're spending millions of dollars in treating these diseases and overtime costs. And I think we should all agree with that. I'm showing you here 7 pictures of Boston police officers, active duty members who passed away from job-related conditions in 2018. And this is what kind of spurred what actually pushed the Boston Police Detectives Benevolent Society for coming to St. Elizabeth's and asking for help in preventing further police officer deaths. And to their credit, they've worked tirelessly to make sure this program has been up and operational, and it's been a huge success. The officer up in the left-hand corner, Joe Lamusio, happened to be a good friend of mine, and I can tell you his family is still suffering after his loss 2 years ago. And I really believe his death could have been prevented if we had this program in place now, instead of in 2 years, in 2018. If we had it then, I think he'd still be alive today. So I hope as we move forward, the legacy of these 7 officers will be to starting a real significant health and wellness program. You have to be in pretty good shape to be a first responder, to pass the drill school, to be police, fire, EMS. You know, it takes a lot of work. They do a lot of screening background. You have to be pretty fit. Unfortunately, what we see though, after the officers graduate from the academy, we see significant deteriorations in their health and wellness. The job beats them up physically and mentally. And we see tremendous amount of heart disease, behavioral health issues, including suicides, cancer, and unfortunately early deaths. And it's not just one exposure that they're exposed to. We talked about the marathon bombing and that terrible tragedy with the Christmas Day event where the mother and killed herself and her 2 young children. And that took a lot of emotional toll on first responders. But it's usually the accumulation of the daily work that first responders do is really harming them mentally. That really sets the brain up for really having a tough time when as a tipping point, a traumatic event that we just talked about. So it's the daily work that the police officers do. Seeing people suffering every day, the human conflict, the volatile domestic incidents, working overnight shifts, forced mandated double shifts takes its toll on the officers. And it doesn't matter how tough an officer you are, how many years you've been on the job, you get that ongoing release of these stress hormones, cortisol and epinephrine, that really beat up the cardiovascular system in the body, as well as they suppress the immune system, and they certainly impair mental health in the officers. So this is the daily grind that's really taking its toll on officers and the first responders. Compared to the civilians that the police officers serve, significant heart disease risk, average age of a heart attack is much lower, life expectancy 15 years less, almost 3/4 of them have hypertension versus 30% of the general population, and obesity is increased as well. We also see police officers at high risk for certain cancers that are listed here as well, and the job also takes a terrible toll on behavioral health issues in officers, from anxiety, depression, post-traumatic stress injury. We're trying to use that word now, injury versus disorder, because of the stigma attached to the disorder. And we know that also that injury means it occurred from the job itself, from the accumulation of these stresses. And as an injury, we also can say it's a treatable condition, and people do recover from injuries with the right help. So I think it's a better term. We do see a lot of self-medicating as well in the police service because of what they've been through on the job. And unfortunately, suicides are much higher than line of duty deaths, including shootings. But as you can see, all these conditions are tied to job stress, sleep deprivation, excess weight from the job itself. And they play a role in all of these conditions. So what we've done at St. Elizabeth's, we put 402 Boston police officers and EMS members through screening programs to screen for cardiovascular disease and cancer. We actually have put about 120 Boston firefighters through the same program, and the results are strikingly similar. And what we've done with these screening tests, every officer, I discussed the results with the officer and also with their primary doc to make sure there's some very good follow-up. And a lot of officers, went to the primary docs, promoted lifestyle changes, many end up on medications, hypertension, cholesterol medications. Some result in stress tests, and I can tell you there's been at least a dozen officers who have had some life-saving cardiac interventions, including catheterization, stents, and surgery, because of what we found on these screening tests. And they didn't know about these problems until they participated in the screening program. And several officers had some cancer treatment successful as well because of the going through these screens. So we did 4 tests. The first one was a carotid artery ultrasound, an ultrasound of the carotid artery. That's the blood vessel in the neck going to the brain that supplies the blood to the brain. So we're looking for any narrowing or constriction, which will give an indication they are at risk for a stroke. And about all of officers, 14% had a carotid artery stenosis, which can't set them up for stroke. That's a very large number to have. What's more striking is our female officers. We only had 43 go through so far, but they were 4 times as likely to have carotid artery stenosis than the male counterparts. And I'm talking to some of the specialists at the St. E's. I can look into this a little further why this may be. Does the stress of the job maybe have more direct effect on the cardiovascular system? We also screen officers for ultrasounds of abdomen, which looking for aneurysms, and 10% actually had aneurysm formations that could put on risk of sudden death if it's not treated properly. And we looked at the lung scans to look for any early changes in the lungs that may put them at risk for lung cancer. The other thing with these scans, they look one from the neck up to the upper abdomen. So we found other things I will discuss soon. 35% of officers had lung nodules that need to be followed closely with their primary doctor to make sure they don't get any bigger or any intervention if they do. That's a pretty high amount as well. At the same scan, when we looked at the lungs, we also looked at their heart, and we got as what they call a coronary artery calcium score. It's been a new test. It's only been out for a couple of years. It really looks at the calcium buildup in the coronary arteries, which is basically a direct marker for plaque development. So if someone has a high calcium score, we know there's a lot of plaque in the coronary arteries, and it puts them at significant risk for coronary artery disease. In 60% of officers we screened had elevated calcium scores that puts them at risk. And about 3/4 of officers over 50 had these elevated scores. So these numbers are extremely concerning. The other things we found, as I mentioned, when we looked at the lung scans, we looked at other things too, and 17 of the officers had ascending thoracic aortic aneurysms. And these things aren't typically found on the doctor's visit or other screening tests unless they get these tests specifically that we've obtained on the officers. And, these aneurysms can kill you, they can rupture suddenly. So I'm very glad we found these tests, these aneurysms, I think, in the treatable stages, because normally they are found on autopsy when they open up and kill you. We also seen a lot of thickening of the esophagus that could be pre-malignant as well, that officers had to go further testing with. And we've seen a lot of lesions in the liver, the thyroid, and the kidneys that their primary docs are following up with. So what do we learn from the cardiac screenings? Again, over half the officers had elevated calcium scores. 71% of these were higher than what we expect for the age group. And again, 3/4 of the officers over 50 had high scores. And these put you at very high risk for coronary artery disease and acute coronary events, and unfortunately sudden cardiac death. So, and we're glad we found these conditions early. A lot of them had elevated scores, followed up with their primary docs, got on blood pressure meds, cholesterol meds, exercise program, weight loss program. Some required stress tests, some required catheterizations, some required stents, and actually some required bypass surgery and valve surgery. So these programs are very effective in finding these diseases in a treatable stage, and that's our goal for the program. Obviously, we want to prevent them from happening in the first place, but this is where we are right now. This picture here shows the coronary artery. That yellow big piece of plaque is what we're looking for when we look at the calcium artery calcium scores, coronary artery calcium scores. So the more damage is done to that coronary artery, the risk factors including hypertension, diabetes, high cholesterol, job stress as a police officer, excess weight, they all damage the inner lining of that coronary artery. That leads to scab formation. It leads to white cells come in, there, platelets, and calcium comes in there, and then the plaque forms. And this is what we see, and that's what we measure on these scans. The problem with this plaque is, if you're doing, police work or fire work in challenging situations, that plaque can rupture and cause complete blockage of that coronary artery and lead to a coronary infarction or sudden death. So I'm glad we picked up these narrowings and these plaques, but again, my goal is to prevent it from happening in the first place. So what do we learn from our vascular screenings? Again, carotid artery disease 2 times to what we see in the general population, what we see in our Boston police officers. And as I mentioned earlier, about 4 times in the female officers compared to the males who were high enough to begin with. This is kind of striking. And 2 times in expected rate of abdominal aortic aneurysms as well. Lung screenings, again, we had more high expected lung nodules than we'd like to see in these officers. They will need ongoing surveillance with their primary docs for lung cancer prevention. One good thing about it is once they had these scans done, their insurance company will pay for the follow-up because they have a diagnosis of a lung nodule. So we don't have to get further grants for those officers. I think the police need to think about particularly working fire details, particularly when you're downwind from the fire, but really wearing protective masks because it is a source of exposure from the smoke, from the toxic smoke from the fire ground. So I spoke to 402 officers and EMS members after each of these scans was done, and a very common conversation that they talked to me about is almost straight across the board. Stress and sleep disorders they're suffering from, poor eating habits, behavioral health concerns, limited exercise and excess weight gain. They were working extra shifts, forced extra shifts. They weren't working out properly, they eating crappy food. and it's just set up for disaster. And a lot of them don't even go to physicals because they're doing double shifts, and they're missing an opportunity to get screened properly. But all of them who've been through the program really felt they were great motivating factors for better self-care and lifestyle changes. And I could tell an officer your blood pressure is 140/90, they're probably not going to care much about it. But if I tell an officer you have a calcium score of 400, you're going to think differently about your life, and hopefully get back to your primary doctor and do some lifestyle changes. So my recommendations from this program, we should really consider screening officers with 15 plus years of service, starting probably at age 40 for these scans is when we're really starting to find these diseases. The city of Boston should really negotiate with their insurance companies to provide coverage. I think the city of Boston budget for insurance is like $390 million. You would think we could, have a little bit extra for our first responders to cover for these tests that to me are very necessary to save lives and save us actually more money in the long run. And I believe we also have a healthcare day set aside for the officers to get these screens done, as well as a comprehensive physical exam that we give to primary docs. We have a special form for police and fire that really helps identify the diseases early. And I think we need to dedicate a full day for officers, each officer to go through this program. I know the city of Boston actually has a half-day screening covered for cancer for all city employees. I think we should do the same thing for cardiovascular disease, make it a full day of screening. So prevention is really the real mission. It's great we're finding these tests and hopefully saving lives, but ideally we need to prevent these illnesses from happening in the first place. And I think we need a dedicated health, safety, wellness division for the police, just as the fire department does now, and really focus on these conditions and prevention purposes. Really promoting the tactical athlete mindset in our first responders, and work with the O2X department, the O2X program that the fire department has done. And to me, it's been very successful in changing the culture of the fire service into a much healthier and fit service. And I think that is the way to go. And I'm hoping to get some more studies on our female officers to see why they have such a high rate of stenosis of the carotid arteries. So part of the role of the Safety, Health, and Wellness Unit really should be directing and leading the mission to optimize the mental and physical health of the officers. That's really educating the force about their unique risks for mental and physical illnesses, whether it be at the academy, at the police stations, and through videos and media venues. Collaborate with the O2X program. The fire department's been very good about getting grants to cover some of their programs. They just got a $750,000 FEMA grant for cancer prevention, and it's going to be a very effective program. And also we want to monitor the program's effectiveness as the taxpayers are paying for these programs to see the reductions in injuries, illnesses, and sick time. And we talk about prehab. I'd rather prevent a cardiac disease from happening than to treat it afterwards. And that should be the whole idea about this program, is preventing these diseases from happening in the first place. Promoting better self-care, healthy nutrition, get back to your ideal weight, help them with sleep. And as I mentioned, that dedicated healthcare day for the first responders. The big topic today is talking about, mental health management. And I think it's all tied together, the physical conditions and illnesses we see in first responders. A lot of it is tied to the mental health component. I know the fire department has done a good job with peer support. It would be nice to have at least one officer in every station and every shift to be a peer support person to help out with critical incident stress issues. We really do a better job to remove the stigma of behavioral health issues in the first responders, and they should never be afraid for asking for help. I look at behavioral health conditions, substance issues as medical conditions, just as I look at diabetes and hypertension and coronary artery disease. It's the same type of disease. Should be treated like one as well. And the idea behind this program really should be looking at post-traumatic growth, all the trauma that you see. There is an opportunity to grow and strong as a person with the right help as well. Person that define your life and mental health. And avoiding self-medicating behaviors is the key, because unfortunately, particularly with access to handguns and mental health issues, we see too many police officer suicides, and some of it is prompted by self-medicating behaviors. We need to do a much better job in suicide prevention. And we really got to train all first responders to never, ever be afraid of asking a coworker that they feel like they're hurting themselves. Because when we talk about, first responder suicides, looking back and talking to the coworkers, they always felt that they had an opportunity to maybe bring it up, and they reluctantly didn't, and probably would have saved some lives. So that is important to get that out there. And we really should have confidential access 24/7 to a contracted therapist specialized in first responder mental health issues, who I really understand the unique job that first responders have, and confidential access when the officer needs, and not wait 1 or 2 weeks with the primary care doctor to get an appointment. As I mentioned, the fire department went through the O2X Human Performance Program. It's a 4-day workshop. We really learn about nutrition, lifestyle changes, teach you about your unique occupational health risk, a lot of mental health counseling, suicide prevention, stress reduction, better sleep hygiene, and preventing injuries, and the strength and conditioning program. This program was met with tremendous success in the Boston Fire Department. Over 1,000 Boston firefighters have been through this program now, over 2/3 of the force. In every drill class, the first week of drill school is this program. This is an introduction to the job. It just shows the city of Boston cares about the first responders, and dedicates the first week of the academy to really teach them how to better take care of themselves. And this should be the model for all first responders in our city. This is one typical workout. There's no weights at all involved at all in this program. This is just one simple workout, 15 minutes, squat jumps, push-ups, squat thrusters, a burpee, and lunges. If you do this 15 minutes every day, it's going to improve your cardiovascular fitness, and it's going to be done on the job as well if you set aside 15 minutes. So you start at 5, 10, 15, 20, you go up and down, and this is a great workout to do. Something simple. It doesn't require any equipment at all. And I can tell you, the physicals we do at St. Elizabeth's on firefighters, we look at the firefighters who've been through the O2X program. I see dramatic changes in the firefighters' health who've been through the program, because they're sleeping better, eating better, they're taking better care of themselves. And I see dramatic changes in body weight, blood pressure levels. Some would go from 3 meds to 2 meds, 1 med, or no meds because of this program. Cholesterol levels improved, sleep apnea scores improved. So I think it's a tremendous benefit to the departments. They calculated this program saved the city of Boston about $4.7 million in reduction in firefighter injuries and illnesses. And another reason why I think taxpayers would be behind a program like this. It's also boosted the morale in the force, and strengthened the resilience in the job as well. Improved substance abuse and suicide prevention. And the family told, you can't put a price on what's happened to the families of the officers who are going through this trauma and injuries. As I mentioned the picture of Joe Lamusio earlier, his family's still suffering 2 years ago from his death, and I believe this program would help prevent things like that from happening. So in summary, this is the police officer's lot at Mount Hope Cemetery and Wackill Street in Mattapan. This is a great place to visit, but police officers should not be in here, residing here in the 40s and 50s and 60s. So I do hope by adopting a model program like this, and the legacy of those 7 officers who died from heart disease, cancer, and suicides, that we can really develop a health, safety, wellness program for all first responders, so they don't end up in this site prematurely. Again, thank you for your time. I appreciate you having me on board.
Thank you very much, Doctor. And before I turn it over to the lead sponsor to start the line of questions, I just had one question, I guess, for the whole panel, which is how do we incentivize all of this for the men and women of all of our first responders to encourage them to utilize these programs? I assume that, as referenced earlier, some folks are not sort of running right in with whether it's symptoms, whether it's physical or mental. So I guess is that something that we can work on with insurance companies to provide incentives somehow, whether it's gym memberships or I could run the gamut as to ways to explore incentivizing attendance at wellness courses. But as Sergeant Joe King had referenced, just sort of the rigors of the job now for the men and women of the police department, and we've heard from both fire and EMS that That's my only issue. I know clearly the fire seems to be ahead of the game with respect to both police and EMS, and Dr. Hamrock is sort of charged with maybe sort of getting them up on par with each other. But that said, how do we continue to, there's more members than we're analyzing or we're getting in for examination, and can we and could we do more on that front? And other than that, if anyone has an answer for that, and we'll turn it right over to the lead sponsor, Councilor Asabi George, to start the line of inquiry.
I don't know, Councilor Flaherty, was that a question to the panel?
Yeah, I just wonder if there's any way we can incentivize and encourage our first responders to take advantage of the peer support unity into a visit with Dr. Hamrock, or follow through on some of the things that we saw on the slide. It's I don't know if we drag people there kicking and screaming. Do they come in voluntarily, or can we incentivize it so that everyone has an opportunity to kind of run through this wellness program?
Well, I think it's certainly a conversation around money and budgets, because that work that Dr. Hamrock's doing certainly costs money, and there was some sort of collaboration around the funding for that study for the 402 officers and EMTs and paramedics. But I also think that that's certainly something that we can talk about as a body, and as we are preparing for next year's budget cycle. I do think that Pat Coulter from EMS, he's pulled together, and I know he'd like to share a presentation on some of the work that they've been doing over at Boston EMS to really engage members in physical wellness for sure, and engage members in some of the mental health support. So maybe Pat could do his presentation, and then we can get to questions.
Sure, Pat, do you have access, or Kerry, can you give Patrick Coulter access to put his material up on the screen?
You should be able to just share screen, and we should be able to see it. There we go. Thank you, Patrick.
Oh, so good stuff. Here you go, Pat.
Is that viewing as a slideshow right now?
Yes.
Okay. So just to point out, very early on in February, actually, of this pandemic, we realized and identified this incident to be a prolonged incident with potential loss for our members. That's one of our 7 or 11 deadly sins that we look at very, very aggressively in peer support as a high probability of causing detrimental effects to our members. So we geared up even in a bit of a time of crisis for not only us, but for the Commonwealth and the country to best serve the membership at that time. Just some overview, obviously, that we talked about earlier. We were created in 1989. In 2004, this became a full-time department position for a member of the service. My prior predecessor served in that position from 2004 to 2016. 2016 is when I came over. It's a voluntary confidential program with 20 members in teams throughout the city. It's peer-driven and clinically guided, which essentially means that although the first interaction you have when you're getting support will be from someone that looks similar to you in a similar uniform with similar experiences, we're overseen by clinical guidance, Dr. Hayden Duggan and Lauren Tempesta, who's a nurse practitioner on staff with us. As I said, we identified this to be a prolonged incident with a potential loss. And we knew that we had to turn everything that we knew on its head, shake it out, and figure out where we're going to move and how we're going to move and do it quickly. So we moved to a virtual platform, which to some was, including myself, a learning curve, and I had a lot of fears and apprehensions about utilization. But what we found by using DoxyMe, which is a secure telehealth program for our clinical services, basically outreach and therapy and interventions, was that we got an increased utilization. More people were seeking services, more meetings were happening with our clinical staff than ever before, and especially prior to COVID. But what we did identify was members of service that were seeking services we'd never seen before. So we could attribute that to being in a pandemic and having increased stressors. But what we found was actually historical barriers of geographically where we are. People were not going to come into headquarters and parked amongst command staff or potentially be seen. So by dissolving that barrier and moving to a virtual platform, that gave us a temporary fix to better serve the membership. But what we also found was we need to go into the internet. A majority of our membership is relatively young. They seek services through virtual services. And we created a website for peer support, which another pushing a little bit of our comfort zone. But what we use that for is a clear, concise place to disseminate information, clear information that's been parsed down. The command staff here did a great job of daily updates on personal protective equipment, what we know about the virus, what you can expect from the department to support you. But we found that it was a lot of information that people didn't necessarily read. So we created a clear, concise place, bemspeersupport.com, where they could seek services, not only for what we have available to them, but just a pairing of information. Very early on in February, we, although participated in the O2X pilot, we don't currently have O2X here at Boston EMS as a department-wide initiative. So in the time as a stopgap and just to continue to push our members out, we proposed and gained approval for a health and wellness pilot program, which is similar to what Dr. Hamrock was describing, but we knew that we were going into, as you hear it now, the dark months, but telling members to isolate, and some of which is a city or a state they don't come from, they don't grow up here, they don't have support systems here, they live with their peers in communal apartments in the city, and they were feeling or potentially feeling that they were alone. So what we did is we created a community and an environment that they could, am I frozen?
You're good.
Okay. We created a community, essentially of belonging, where there was no paramilitary structure. There was no rank in a room. It was a place where an hour a day you could focus on yourself. And we offered that department wide, and we'll get into that in just a moment. But it's a testament to Chief Hooley and his leadership, as well as the union and the medical director, that they were even willing to hear us out on this in a time when we were looking at certain long months of a pandemic ahead of us. Also, in order to continue member health, our MIS and data department, along with Do It, created and launched the Boston EMS chatbot, which you can see on the right side of your screen. This is a daily check-in that you get from the department that asks you about any screening symptoms that you may have: a fever, sweats, body aches, headache, loss of taste or sense of smell. You answer yes or no, and that's it. Well, you think so. But after that, there's a follow-up question that says, great, if there's any other needs essentially that we can help you with, let us know. And that allowed for free text. And that free text actually came into myself and Lieutenant Savicki and for peer support review to see those of our members that were just struggling or that needed someone to talk to or that were feeling alone or were, had a family member that was sick. Basically, it opened a conversation. It created a soft touch point for us to reach out and offer services. As far as the information sharing, we were, like I said, we were pushing out and paring down information that the department was communicating, but we also went into podcasting, which I am not one to like the sound of my voice, but we covered topics that we really kind of monitor the membership. What were they talking about on social media? What were they arguing about? What were their fears? What were their apprehensions? And to try to mitigate what was going on, we covered those topics in podcasts with experts that we found. And whether it's on health and wellness and coping or parenting or just disaster psychology of saying, this is going to be a long incident. This is what you can expect from your body. These are the stresses you may face. And this is where you are, where you may end up. So where you are, where you're going, and when you expect to arrive there. If you give that information and communication is the antidote to chaos and anxiety in an organization. If you clearly communicate that, plus enhance it with lifestyle changes and recommendations in asynchronous learning through virtual platforms like YouTube, you will best prepare your agency to be resilient in a prolonged, protracted event. So some of the information that we had posted is not just from Boston EMS and not just from the command staff. It's from experts in their field and mental health providers, as well as, unfortunately, coping with grief. On September 16th, the EMT you see horizontally here being held by her peers, we lost as a result of COVID-19 complications. And that was something that rippled through our agency. You may notice she's not standing amongst this group. She's being held by them. She was loved by many, admired by most, and just an appreciated motherly figure at Boston EMS. And this, unfortunately, was just one more element of grief and trauma added to an otherwise stressed workforce. These are some of the other topics we covered. We won't beat that to death, but also centralizing services. You know, ourselves, myself, Pat, Joe, we often bounce things off of each other. And usually it's a sharing of resources and a pooling of what would you do in this instance? I just need some guidance. You know, never breaching confidentiality, just what would you do? So we centralized services that Boston EMS was offering, and I know most city agencies were offering about housing, what to do if you're sick, how do you self-monitor? But what we identified early on was that having a younger workforce, they didn't have as many resources. They didn't have the support structure. They may not have families in the city, state, or even country for that matter. So we kind of had to instill a support network amongst them. And we did that through our department's infectious control office. We enhanced that office to supplement the physicians that are currently, they work for Boston EMS, they're our medical directors. They hired nurses and nurse practitioners to continually track COVID-related exposures, illnesses, symptomatic patients, members, and treat them and guide them to their primary care. But what they noticed very early on is a majority or a lot of our members had no primary care. So when you speak to Dr. Hamrock and people that were not necessarily seeking or that had not seen a primary in a long time, it may be because they don't have one, or their primary is in Connecticut or Cape Cod or somewhere that's just not feasible for them to go back and forth to. So we knew that we had to early on break down that barrier. So we're working now with a new, a soon to be hired additional nurse. We'll be focusing on touch points such as that, creating a system for them to get into primary care if they don't have one, know what you should be doing when you're 35 years old and 40. If you don't have parents to show you that, you need to learn it from somebody else. There's certain preventative measures that can be taken to best get them out the other end in 32 years, not only alive, but healthy and thriving. So part of this was taking care of those that are sidelined. It's very, very difficult for our membership to not be in the game, to be told, you must stay home. I'm not sick, but you must stay home to protect those that are still active because you've had an exposure. So keeping those folks in the game, having a daily check-in through the chat bot really opened the communication. But for those of our members that were homesick, the DICO team, the Department's Infection Control Office, identified peer support as the confidential conduit to getting these department-funded care packs to our membership. So 51 to date care packages have been delivered. You can see it's mostly comfort food, Tylenol, masks, a thermometer, hand sanitizer, cleaning supplies, things that just help them not have to leave the house. And they be supplemented as needed. So a daily verbal check-in from the DICO staff, an opening of conversation with peer support, just provided a more protective measure for those that are home isolating and potentially feeling a little depressed, feeling out of the game, you know. And if there's something going on, our members want to be there. It doesn't matter what it is, they want to be there. And they want to serve the public and they want to take care of the residents and visitors. So what's important to note here is that 2020 has brought on additional stressors to a population of Boston EMS and people of color. With George Floyd and COVID-19 and the economic decline and civil unrest, we're really kind of being pulled in two separate directions. And members of color are feeling that even more so. They're seeing people that we love and respect in the Boston Police Department being vilified at protests. And we're amongst them. We serve with them and we serve the public, but we're here for everyone's safety. And members experienced, oftentimes we get a pass as the helpers. You know, we go to scenes that are potentially hostile and dangerous, but often, most of the time, we are given a pass to treat those that are injured or ill. And what we're seeing is the opposite currently. We're not being attacked every day, but there is a certain level of uncomfort in a uniform. And then when you go back to the community that you live in, that you've lived in your whole life and not necessarily being accepted, they have increased risk of COVID-19 and the detrimental effects of it. And just in general, in March, we had a forum at the BPBA EMS Division Hall, and we heard a message loud and clear from our membership. And that was they felt that they were underserved or underrepresented in peer support. And I heard it, and I heard it loud and clear. And what we did is we knew we had to take steps and measures. If people are in crisis or in trouble, they often seek people who look like them, are similar in age to them, similar religion, age, gender, orientation. And we need to push the envelope and make sure that we represent everybody in this department. And everybody has a conduit to care. So we committed to training in January to diversify the peer support team, Black, white, Asian, Hispanic, LGBTQ members of service. There needs to be a touch point and a clear path to services for everyone. So if they vocalized it, we will respond to it. And this is the response currently, and we'll continue to expand and learn as we go along. We talked about earlier, just in general, of suicide prevention. That is the ultimate goal, keep everybody alive. But if we settle with that, we'll never get to the next benchmark that we need to, which is keep everybody well, retired, happy for as long as we could possibly get them. We need to commit to that, not just alive. US statistics of suicide are ever increasing, but the best chance of cardiac arrest survival is in Seattle, where the highest rate of people that are trained in CPR exists. So there's no unusual phenomenon that training and treatment go hand in hand. So we've committed to training every single member of our agency in the next training cycle in January in QPR, which is question, persuade, refer, which basically says that every single member of our agency, uniformed, will know how to identify, refer, identify a potential suicidal person, persuade them to get treatment, or push them towards peer support, or refer them to a clinician. So no one is going to walk through this alone. Essentially, we understand that the membership is under stress, that even unusual stresses that we could have never predicted. But to have every member and trained in this, not just a subset or a small group of folks, will better help capture anyone that is at risk for completing suicide. So out of all of this and what we've just talked about quickly is the Health and Wellness Pilot Initiative that we proposed in February and gained approval and launched before the beginning of Recruit Class 20-2. So the goal being is it was a 3-phased rollout. It was really an Recruit initiative in phase 1, but just keeping in mind, we're bringing members of service into a workforce that's known to be stressful, but then throwing a pandemic on top of it with folks that are struggling potentially in a new city, for competing for a new job for 28 weeks of training that they may or may not get. And we had to create and instill resilience. And we didn't do it through the normal measures that we've taken in the past. So we instilled this wellness component. And what we really focused on was multiple touch points, being clinical guidance, taking mental health and stigma out of the darkness and putting it right out into a program that they will see 1 hour every single day, bringing yoga and meditation into Recruit PT, bringing CrossFit, personal training in every single one of our recruits. While we don't give nutritional advice, we help them seek success for themselves. So prior to coming in, they upload everything they ate the week before the academy to our Health and Wellness Staff platform run by Felicia Hickey. And they go through everything and they say, hey, what are you trying to do? So when you talk about unhealthy eating habits, if you stop it where it starts in an industry that historically, most of our guys eat in the front of ambulances on street corners or from sub shops or from Chinese food restaurants or places that they can get something quick and get back on the road. And if we can stop that by teaching meal prep and teaching how to plan for success early on, we can change systemically the culture that knows differently. So if we commit to that in the beginning in phase 1 through fitness, yoga, meditation, nutrition, being within yourself for 1 hour between your own ears and reflecting in, plus the clinical component, which is every single member of the recruit class that started in this met and sat down with a department clinician. Not ordered, there was no therapy going on. It was just an introduction of who they are. Take the stigma out of it, take the mystery out of who they are or where they are, and create a relationship from the jump. So when you are in crisis, you wouldn't think twice of picking up that phone and saying, hey, Lori, I'm in crisis, and this is what I need. Just real quickly, is phase 2 and 3 that are now all rolled out. Phase 2 was opening it up to the membership. We're still under COVID restrictions, obviously, so it requires pre-signing up, wearing a mask, in exercising or meditating or doing yoga at a distance. But we found great success in getting members out. Quarantining and isolating for those that are first responders in the public to do work, home, rinse and repeat for months on end is going to be detrimental. We have to make some concessions, and this is the one that we're choosing to make right now in creating the safest environment that we can. So what we've seen is success. We've now branched out where members of health and wellness are doing Zumba, they're doing golf, they're doing yoga, meditation, and they're just basically a community amongst themselves where they are taking care of each other. In phase 2, we created future leaders, recruits teaching deputy superintendents, recruits teaching classes to captains of this department in an equal level playing field. So members of this recruit class that you see are now working as associate instructors in health and wellness and really breaking down the barriers of, if you haven't been here for 15 years, well, I know that deputy, I teach yoga to them. So what we're trying to do is now it's rolled out department wide. So following the restrictions that we have to keep our members safe right now, they're working out amongst each other. They're treating themselves right. They're treating their body right. And it's really a unique time to capitalize on this because our members, although they're stressed and working more than ever, they've never had more free time as well. When you think about everything, every social activity, weddings, christenings, everything has stopped. So we've asked them to fill that void with something for themselves and hoping that we create a culture and just a general understanding of this is how you should be treating yourself. And we hope that in the years to come, we will see this ripple through a department and change a culture that's already starting to grow. So thanks for listening out.
Thank you very much. So with that, we're going to turn it over to the lead sponsor. I know we have colleagues that might have some questions as well. So Anissa or Sabi George, if you want to start the inquiry. And
Thank you very much, Mr. Chairman, and thank you everyone for those for the presentations and the conversation and the work that you're all doing to support your members and to support members of other departments during this time and by extension their families and then by extension our communities across the city. I'm just very grateful for your time, your work, and your commitment to this. Dr. Hamrick, my first question is for you. A lot of your presentation really was great to just have a deeper understanding of the impacts of stress and chronic stress. I appreciate too the education around the post-traumatic stress injury as opposed to disorder, and I will take that on as a part of my regular vocabulary as well. A lot of your work certainly was focused on BPD. When we think about the statistics and the impacts, I imagine that it's similar across EMS and fire too when we think about the impacts of stress on the body.
Yeah, I talked about the police today, Council, but certainly the similar with police, the EMS and fire as well. And I can tell you it affects their physical health as well. The mental stress they deal with on the fire scenes and dealing with critically ill patients beats them up physically and mentally. And I see the same stats actually. The 150 or so Boston firefighters we put through the screening program, the results really mirror the police department as well from the mental effects of their job. I don't have as much numbers for EMS because the majority of those 402 we screened were Boston police officers. But the ones that we do see certainly have significant diseases as well related to the mental health effects of the job.
Right, and I appreciate too your focus and your continued focus around the impacts on female officers around the prevalence of disease and or presentation of potential issues. For Pat and Joe and Pat, where do we see the gaps in care? Like where is what's missing? Or what are the things that are missing that we can be supportive of? I know, Lieutenant Coulter mentioned members have to go through headquarters to get support services. To me, that is a potential challenge or barrier to accessing care. Where are some of the other gaps in services that you're not able to give your members?
Well, I would say one of the main gaps is the insurance issue. Harvard Pilgrim, as we discussed briefly yesterday, Harvard, I think the number 70%, 75% of city employees have Harvard Pilgrim. The mental health component of Howard Pilgrim, the billing component is a hurdle. So a lot of clinicians that we did use before, they don't accept us fire people anymore, just because the comment I would get was, Pat, I meet with someone for an hour and it takes me 3 hours to get paid. And so I'm not sure what the process is because I'm not a clinician billing, but I know that that's been an issue, an ongoing issue. We've lost some good clinicians because of it. And we have kept some people in the loop. The Leggett group from Rosendale has stayed with us, Sarah Henderson, Chris Walsh. There's certain individuals that don't mind doing the extra, but they have some of them have family members that are on the police or fire, so they want to be there for us. But I do know it is an obstacle trying to keep good clinicians because of the hurdles of getting payment from these companies. So whenever I go into the drill class, when they bring a new drill class into the academy, I often talk to the members that are coming on, and I say, you were pitched a program of an HMO, and if you pay the extra $100 now and get a PPO, it serves you better because you'll have more access to more healthcare. You can go where you want, pretty much. Another issue that we do have with the healthcare is that the city incentivizes the veterans to not buy into the city insurance because I think they get a $2,500 reimbursement a year, or I don't know what but if they don't buy the policy and they use the VA, then they get a refund or an incentive check for not using the city's insurance. And then when we come to certain issues where, say there's a substance abuse issue, say we have a firefighter that had a knee replacement or shoulder surgery and they're on pain medication for 2 or 3 months, they cannot be on Suboxone when they come back to work. So, because they can't work on that. And then we'll have members that'll say, well, I have a problem here. What do I do? And if they try to go on Vivitrol, which wouldn't come up on a drug test, if they get injured, now pain medication won't work for them because it's an opioid blocker. So their device is to go to the VA, and the system there, if they go to a detox at the VA, they might only get 3 days. They might not even get seen in an actual residential setting. They might get Suboxone to take home. And again, it would be the insurance issue. So the other problem I look at is that in Massachusetts, if you come in with a substance abuse issue, we don't really have a 28-day facility that we can send you to in state. So if I'm talking to you and you're on pain medication, you're trying to get off it, and I'm telling you the only 28-day program we have is down in Pennsylvania, and you got to uproot and go down there for 28 days, it's a big ask for someone. And then again, with the threat that you're in trouble with the job if you test positive. So I think looking at the insurance issue would be very helpful. And if we could somehow figure out how to get people a longer term in treatment in state, like at a Gosnold or a NORCAP, or High Points or St. Elizabeth's or the Faulkner or one of these facilities or McLean's. I think that would be helpful because a lot of people look at it and the residential component is overwhelming, but then having to pack and leave the state is also another effect. That's what I think.
Great, and I do want to just echo your accolades for the Leggett group. Jen Leggett's been someone who's taught me a lot about accessing mental health services, and the work that she does and her groups do are amazing. So grateful for mentioning her and her work. Joe, do you have something to add?
I think the biggest thing is, and you made mention it before, Counselor, is time for my officers. That's the biggest issue. Is a lot of them they want to get the cardio workout in. That's the biggest thing we preach when we do a critical incident debriefing, and that's been something I've been focusing on since I've been involved with the unit on a volunteer basis prior to taking over for 20 years. Is that cleaning out of the bloodstream, that 20-minute to half-hour workout or some kind of elevated heart rate we can get for the officers to prevent this buildup from all the chemicals they have dumped in the stress response. Excuse me. So the biggest thing for us right now is time. Thank you.
Appreciate that. I don't know if anyone has anything else to add before I return to other colleagues.
I'd like to say, with the, city of Boston, you pay about $20,000 per employee for health insurance. And I think questions are we really getting a bang for the buck with that? And particularly mental health issues. If you have an orthopedic condition or a cardiac condition, I can get you seen today. But if you have a mental health condition, the insurance takes several phone calls, may take a week or two to get an appointment that should be seen today. So I think we need to leverage insurance companies that the city of Boston's paying, saying, let's guarantee same day visits as we do for other conditions, including diabetes and orthopedic conditions. I think it's going to take some leverage in that part, but we're spending a lot of money for these insurance plans, and are we really getting the money for what we're paying? I mean, unfortunately, I have some good connection at St. Elizabeth's where I can get someone seen by a counselor with a couple of different phone calls, but not everyone has that access. And I think we really need to look at that and really focus on insurance companies. Are you treating behavioral health issues as you're treating these other medical conditions that people have?
Yeah, certainly there's no parity, although it's been legislated, there is no parity between mental health and physical health care. And Lieutenant Coulter, anything to add?
I think access does remain an issue, especially since most of us are seeking specialized programs. So I think it really speaks to, enhancing the first responder. And this is a private sector thing, but, certainly creating more spaces. Currently, for example, Leader, which we all use, I know the fire does at least, and that's 6 spots right now. That's 6 beds, 4 men total. So they operate at a 2 to 3 week waiting list to get our members in. So insurance, I could say, and I think I would speak, City Hall has gone to bat to help us advocate for ourselves where we couldn't necessarily do it. But certainly just barriers when it comes to PPO and HMO. And I think that the city would have some leverage considering the amount of us that are on different plans, but certainly insured through the city. That is a glaring need, is just access. It shouldn't be, the hardest part shouldn't be getting in. The hardest part should be convincing someone to get in.
Right.
And if we able to get all of the legwork done to get someone to the point of clearly deciding they're going to seek treatment and then being stonewalled is disheartening in the least, or being told you got to wait 2 weeks. That's also a problem that both sides can feel the effects of.
Thank you for that. Thank you, Mr. Chair. We maybe have lost Chairman Flaherty's audio, so I do know that Councillor Flynn was next on the list. Councillor Flynn?
Thank you, Councillor Sabi George, and again, thank you to the panelists for their tremendous work on these very difficult issues, and we really appreciate everything that you're doing. The fire department, I know the stat was 50% of those that retire die within a couple of years after retirement. Many of the firefighters knew my Uncle Dennis very well. He died young from heart disease, and he was like a second father to me. So I miss him. So this issue is very personal, and whatever I can do to be helpful to the fire department, the police department, EMS. But I think the rhetoric and the verbal assaults on police, on EMS or fire is having a devastating impact in cities across the country. Police are already under PTS related challenges. And about the last thing you need is someone, verbally assaulting you. I think we also have to have a public awareness campaign about the destructive comments that take place, that they really hurt so many people that are trying to do a good job on our behalf. You know, when I think of the police officers in my community, I think of Bobby Flynn, who's a Little League coach, or Richie DeVoe, who's active in the community, or fire department, Willie Osterguy. But those are people that are always giving back. But I guess my question is, thinking of it, especially the police department or the fire department. I know you have a lot of veterans on your department, and you know we hear about the forced overtime, especially the police department. Many of them working double shifts. You know, when I finished my deployment, I had access to the VA hospital medical care. And I went frequently, and I still go to the VA. But how can you access, you know, medical care at the VA if you're a police officer when you're working so much, and the department is counting on you to work, you know, 14, 15 hours a day, 6 days a week? You know, you need a break to, you know, go to your medical appointments, your mental health appointments, to take your daughter to a dance lessons, or your son to a baseball practice. But I wish there was an extra part of sick time, you know, for our city workers that they can use to deal with a lot of these ongoing challenges. But I am concerned that we don't give city workers enough sick time so that they can deal with a lot of these ongoing mental health challenges. You know, we see 24 veterans commit suicide a day. Certainly that's a staggering number, but I also know it's a high number as well in the police departments across the country. But I just wanted to ask Joe, is there any way we can think about, you know, short-term or long-term, of how we get access to sick time for our police officers or for our EMS or fire department? Just generally speaking, if you had any thoughts about that.
Well, I hate to default to the standard answer, but that's above my pay grade, but it's way above my pay grade. But I can say, at least on the veteran end of it, because we do have a good deal of veterans, and we actually have a lot of officers that are still in the reserves and still deploy and come back, have multiple deployments under their belts, and come back and have to step down. One thing the on-site and Dr. Duggan started and pioneered years ago was Restore. It's a Restore weekend, and we send our officers who are veterans. He holds it about, and he does it pro bono. That one's for gratis. It's pro bono. It's not part of the contract we have with the city, that he has with the city. And about every 6 weeks right now, he'll have a group of veterans up that are either fire, police, EMS, and they go through his Restore program. And I think it's important, especially for all branches, and not to, like I said, I can only speak for the police too. There is a big mindset change. You're coming off deployment, and now you're going back into the streets of the city, and you're armed again. And it's a crazy downshift, if I could put it that way, or a crazy shift of gears of being deployed. And I can say for a fact that because of the riots and the protests, and a lot of these protests are more ad hominem personal attacks at officers standing in line and being directed at them and their families. And language, to be honest with you, I've been on for 30-something years. I worked at the old Charles Street Jail, Nashua Street Jail, and I've been on the police department since '94. The threats being made and the statements being made to officers are at a level I've never heard, being directed at families. And for a lot of these officers are saying the level, and when they're not just being said, their personal space is being violated. These people are technically, not to sound silly, but social distancing. They're getting right up in the officers' faces, trying to provoke them to do something. And a lot of the officers who are veterans have said, you know, I feel like I'm back into a deployment. I'm not even sure which, you know, for a minute there, I feel like I'm back overseas with the level of, you know, there's a cruiser down the street burning, there's people screaming. It's just insanity. And that has been a big big issue, like, on the veteran end of it. And so the big thing we've had is Restore with Dr. Duggan, which is huge. And we also, like I said, made some great inroads with Dr. Marika Solhan at the Boston Vet Center, and her and the community outreach person there, Clifford Coy, who is a vet at the Boston Vet Center, to expand my services to officers. It helps to Pat Coulter's point. McLean is down to like half capacity for the leader program. So you think of fire, EMS, and Boston all sending personnel to the leader program that has 4 beds now or 6 beds. It depends when I talk to them, when we have our people call. And they're not, and we obviously, we pioneered it, we got it going, which was great. Like everything from McLean, now it's wide open to everybody. The whole state's using it. So it's, so right now my biggest thing is, and it kind of speaks to the insurance too, because without having a PPO, my resources are limited. So a lot of times what I'm doing is, are you a veteran? Yeah, or maybe I can farm you out, not to be crude. We can get some services through the vet center. We have our people through on-site. We're going to get you appointments with the doctor. We're going to get you appointments with the licensed social worker. We picked up extra hours through the grant, but just like, but part of the issues we're having getting outside help. Sometimes people just need different services that we can't necessarily get our hands on. One is the insurance, and 2, because of COVID, a lot of these docs, these psychs, these therapists just aren't taking any more patients. They're overwhelmed. So I hope that answered that the best I can. As far as the sick bank thing goes, it's really like I can't say it enough, at least in the police end, because our schedule is different. There's time, trying to have some built-in time in there to get stuff done. And lots of times when these officers have time, they go home. They want to, like you said, see their kids, go to games, do this. A lot of them are. I don't know how we all did it. I coached my kids.
Yep.
They participated in a lot of things, and and it gets back to the same old thing again. A lot of these officers will do for other people, but they're very, very hesitant to ask for themselves. And it's just part of the culture in which we try to overcome on a regular basis. And also with the police too, obviously there's issues with, if I come in, I ask for help. If I say X, Y, and Z, are they going to take my gun? Even if it's physical. If they say, hey, they might find out that I have a bad heart, or my lungs aren't working right, or whatever the case may be, I'm not going to that, because they find that out, that I'm sitting, I can't make any money, and because I don't have my gun. And it's, like I said before, I said at the meeting yesterday, the firearms is a tricky thing, because a lot of people look at it as a symbolic political hot button firearms, but for the police officers, it's just a tool of the trade. And I'm not saying it to be crude. It's an essential part of their equipment. It's an essential part of completing their missions. It's something that's almost never used. The stats bear it out. Probably 1%, 5 to 1% of officers ever discharge their weapon in the course of their careers. And but the reality of the matter is, without it, they can't go out on the street. They can't do their jobs. They feel incomplete. And the reality is they bear a financial penalty. So that's kind of where we are. Thank you.
Thank you, Joe. And you definitely answered my question, and I have no further questions. And just wanted to leave you with one final comment, if I may, is I had the opportunity to talk twice to police officers' spouses, just on a Zoom call, just listening to their concerns about family life. And it's very, very similar to a veteran coming back home and dealing with ongoing challenges. But the challenges police officers are facing and their families is very significant. I'm so glad that Councilor Sabi George and Councilor Flaherty have called this. It's probably the most important hearing I think I've attended in the city council in 3 years. So I want to say thank you to my colleagues for calling us, and I hope to focus on my hearing after the new year. And that would be basically a registry of any type of illnesses or issues, medical issues someone had during this critical time. in making sure that we try to document it, because I think these medical conditions are staying with the police, fire, and EMS, and having a significant negative impact on a family's life as well. So I want to say thank you to the panelists, say thank you to Councilor Sabi George, Councilor Flaherty, and no further questions. Thank you, Councilor Sabi George.
Good. Thank you, Councilor Flynn, and Councilor Kinsey Bark is still with us if she has any questions of the panelists.
Yes, thank you, Mr. Chairman.
Okay.
I really appreciate the presentations from all the services, and I have one comment and then a question. The comment and commitment really is that when I first got on the council at the beginning of the year, I think it was in January, that we had the hearing around the new PEC arrangement around insurance, right? We do those in these 5-year batches. And one of the things that the council heard at the time was that part of the negotiation was that the city was going to engage in some new plan structuring. And I think it sounds like it would make sense for us to check back and find out, because I think those plans, what we were voting on in January had not yet gone into effect. And so I think it probably makes sense for us to figure out in what ways the new 5-year agreement is going to help with some of these issues we've heard about today vis-a-vis insurance. And then, to the extent that it's not going to help, we really need to put that front and center for the next negotiation, or think about whether there's a need for a supplementary one. So I just wanted to flag, as the Ways and Means Chair, so obviously a different committee than where we are today, that's something that we'll definitely follow up on, because I think it sounds like it's a concrete barrier for some of these things. And then my question, and it's really, I guess, for Dr. Hemrock and for Joe, is in a hearing we had a few weeks ago, we heard about this really significant uptick in officers out in sort of extended sick and injured category, and the first instance of that uptick, it had been kind of sitting at about 150 officers. And then last year, so between January 2019 and Jan 2020, so before the pandemic, and the most recent issues, it had gone up by 60 officers, which is like, almost 50%, 40% rise. So I was wondering, it was really helpful for me, all the context that I heard today about the pressures of the job and the way that plays out in people's sort of body and mental health. But whenever I see something that dramatic changing, I obviously am asking to myself, like, what has changed and how can we reverse it? And because it's prior to COVID and prior to all of the developments of this year, I'm trying to get a feel for what that could have been. And I was wondering whether either of you are able to shed any light on what new pressures or new dynamics on our officers are causing that.
I mean, to me, it's possible just the cumulative effects of the job are finally catching up to these officers, and it's probably showing in some of their illnesses and injuries. It was before COVID, certainly we see a lot of officers come down with COVID, and some are still suffering the long-term effects of the COVID, and they're not 100%, unfortunately. But I would say it's more just accumulation of things. I haven't heard anything specific around that period of time why there would be an increase in the time off like that. But I could see, the cumulative effects of this job catching up, particularly these officers in the mid 50s and late 50s, really seeing the effects of beating them up physically and mentally. And I think it's finally catching up to them.
Joe, did you have any comments?
Excuse me. Well, yes and no. One is I can't comment on the numbers because I don't know, individually what each officers are going out, or if there's a certain type of injury that's maybe there's a significant rise in certain types of injuries. I'm not really sure. But I'd have to echo the doctor's point, and I think a lot of it is, I don't know if the numbers, if the initial injuries going up, or the amount of or is the duration of time that the officers out staying longer, so they're driving that number up. So it's a larger aggregate that's out. You see what I'm saying? Where it's an issue, like we have a lot more officers out, but if you're looking at it, they've been out for a longer period of time, and they're not getting back as quick. And I think a lot of it does get down to what we're talking about here, whether it's PTSI or physiological determinations. And I think, like I like to write a little equation. I call it like emotional erosion is equal to physical plus mental maladies. and then all of them together add up. And, so I really couldn't say as far as the numbers, but I would think it's more along the lines of like what the doctor said. And also I'd want to check if it's just an aggregate that's grown because the recovery process isn't as quick as it used to be.
Yeah, no, I agree. That would be really helpful to understand. And yeah, and in terms of what the doctor said about catching up, I guess to me then, I guess that would make sense if we have a particular sort of bubble of officers all in the same age range, right? Like if there's something that's changed. I was struck by how much it had been sitting pretty consistently. Obviously those 150 that it was sitting at consistently were changing who they were, right? And now for it to go up 60 in a year, and then, it's gone up another 60 this year, but I think there we can have more of an understanding about the COVID impacts and other things, right? But like to have gone up last year by 60, it just, it's really striking. I think you're right, Joe. It would be good to understand whether that folks who were on that injured sick category in 2016, 17, 18 are just still there because there's a really long duration issue or what, but it's very concerning to me. There are obviously, budgetary and other implications when we're replacing 94 officers a day worth of folks, but more concerning to me is just the idea that we've got this like real sudden swell in long-term injury. So I'm hoping, I know there are folks in the department who are looking at it. I'm hoping that, as folks figure out what's going on there, that you could share it back with the council, because again, if there's a policy thing, if there's a conditions of the job thing, if there's a, anything that's causing that bubble, I think it's like pretty urgent that we know, because now we're at like 12% of the force or something in that category. So it just really underscores the importance of this hearing today. Mr. Chairman, I think those are my questions for now.
Very good. Thank you, Councilor Bach. And anything from the lead sponsor? Any final comments before we let the panel go back to doing what they do best?
No,
Protecting
thank
the
you.
city and protecting our members.
That is right. Thank you, Mr. Chairman. And thank you, everyone, for this hearing today and for, again, the level of conversation I think has been really in-depth and educational for all of us. And I think it highlights the importance of us as a city being more proactive around making sure that there's access to both physical and mental health care and wellness programs across the board. And that proactive certainly starts at the academy level, and we'll probably see, as we've done more of that as a city at all academies, we'll see that benefit over the long time. But the members that are members now need to make sure that we have access to the right care, and being more proactive saves energies and resources for when we have to be reactive to incidents. And, I think for me, it's making sure that as a city, it's our responsibility to ensure that our first responders, those that protect us and respond to our calls, our police, firefighters, and EMTs and paramedics, that they have access to high quality services across the board, across the spectrum, and that we make the time for them to access those services. Because we're hearing that it's one thing to have a desire to do, or to be seen, or to be well, or to get well. But if you don't have the time to do it, it often just gets pushed down on the list. So I think that we've got a few sort of tasks before us when we think about the work that's left undone, that we need to focus our energies on as a council, certainly in collaboration with all of you. So just grateful for the education and for your time and for your continued commitment to the physical and mental well-being of our first responders across our city. Thank you, Mr. Chair, and thank you to Pat, Joe, and Dr. Hamrock for being with us.
Good. Thank you, Councilor Sabi George, for putting this forward, for my colleagues, Councilor Flynn, Councilor Bach, Councilor O'Malley for attending, and obviously the panel, our Commissioner and our Lieutenant Sergeant and the Doctor. I think it goes without saying that the Boston City Council loves our first responders. You guys have a great ally in the council. Anything we can do to continue to work together to support these programs that help protect the men and women of the Boston Police, the Boston Fire, and EMS is something that I wholeheartedly support, as do all my colleagues. So thank you again to Councilor Sabi George. And with that, docket 0503, it's an order for a hearing regarding access to wellness programs for first responders. This hearing will be adjourned. And have a great weekend, everybody. It's great to see you, Joe.
Thank you, everybody.
Thanks.